All right, pulling back the curtains. Full disclosure on pediatricians, vaccines, and money. Now, I'm Dr. Ross Newman. I am a pediatrician as part of a privately owned practice where us, the physicians, own the practice. And as one of the owning partners, I know all the ins and outs about the financials and about how vaccines relate to any of that. The first thing to note is that every dollar that comes into this clinic is paid to us by insurance companies. There is no pharmaceutical money that comes to our practice, and you can even check that on openpayments.cms.gov. Spoiler, you won't find my name there because I've never received any money from pharmaceuticals, even in the form of a lunch. Our revenue comes from visits done and procedures and things done during those visits that generate billing codes that we then bill to insurance. And we are compensated by insurance based on the services we perform. Sometimes even get audited to make sure we actually are performing the services we are billing for. Let me show you our vaccine fridge. There she is. Now you notice there's two stocks of vaccines. One is the VFC stock and one is the private stock. VFC stock are free vaccines through the Vaccines for Children program that the state gives to us to make sure that all children, regardless of ability to pay, have access to vaccination. And private vaccines are vaccines that we purchase from pharmacy companies in order to provide for our patients who don't have public insurance. As a physician group, we actually have the highest percentage of public insurance patients. And we do this knowing that this is a financial hit to us because compensation for publicly insured patients is much lower than privately insured patients. We believe that all children should have the same standard of care regardless of their ability to pay, so we have a huge percentage of our practice that actually has public insurance, which makes us a lot less money. And their vaccines are given to us for free and dispensed for free. In regards to our private vaccines, we purchase them at price and we charge the insurance companies the price that it costs us. No profit there. But that big, beautiful fridge you see and the regulating and the wires and all the things it takes to maintain those vaccines actually comes at a cost to us and is one of our operating costs, so it actually decreases our profitability to maintain those vaccines. Finally, let's talk about quality metrics. Quality metrics refer to metrics put out by the state for providers who are accepting public insurance. And they're put out to make sure that people who are accepting public insurance, remember the lower paying insurance, are meeting quality care standards. Otherwise, they'll be compensated at an even lower rate compared to the low rate that public insurance already pays. And there are lots of different metrics. So this is 4 pages. On the first page, we see prenatal and postnatal care, preventative oral care, screening for depression and follow-up plan, social determinants of health, young children receiving social and emotional issue-focused interventions, adults with diabetes oral evaluation, assessment of children in DHS custody, well checks for kids and adolescents, and then we see there is childhood immunization status, adolescent immunization status, as well as diabetes care, initiation engagement for substance abuse disorders, and meaningful language access. In summary, if the state's going to pay you to do a service, you better be doing it right, or they will pay you at a lower rate. So there's no financial incentivization to give vaccines, but we do want to make sure that we are vaccinating kids because that's part of quality of care, just like controlling their glucose or making sure they have access to mental health or prenatal or postnatal care or oral health care. There's no big pharmaceutical bonus. There's a reason pediatricians are the lowest paid specialty. Honestly, I don't know how to be more transparent than this. These are all publicly available documents that you can look at for each state. The real truth is those who want to villainize pediatricians and make it seem like we're vaccinating in order to get financial incentives are really just promoting their own political or financial agenda in order to get you to distrust your pediatrician who really is just looking out for your child. Hope that helps.